Good afternoon, everyone. It's a great pleasure delivering a talk on delivering quality cardiac care in Tier 2 cities, issues and challenges on your webinar platform on this World Heart Day 2016. We know that India ranks 143 among 188 in the world as per the latest global reports. Of course, on health front also, India ranks 143rd among 188 nations and just better than Pakistan and Bangladesh. With the control of communicable disease burden, non-communicable diseases are the leading cause of death. Cardiovascular diseases is the leading cause of death in India and world over. 60% of patients with heart disease, including coronary artery disease, live in semi-urban and rural India. The burden of cardiovascular disease is around 20 to 25% in the country and much more in north and eastern part of the country, including the state of Uttar Pradesh, where I live now. There is a likelihood of doubling of prevalence of cardiovascular disease burden in the next 5 to 10 years. And it is projected that by 2030, India will be the leading in numbers of having the highest number of persons having cardiovascular disease, a rather disturbing distinction. People in Tier 2 and Tier 3 towns have the right to world-class doctors and technology. Isn't their life as precious as a person in the metro, having come down from a Tier 1 city working in a big hospital, moving to this Tier 2 and Tier 3 city, especially in the western part of UP, I see the challenges are too many. Regarding the comprehensive cardiac care facilities, we find these facilities only in Tier 1 cities, that too in metros, and of late in other capitals of the states. Though it is percolating to Tier 2 cities in south and some parts of western India, it is far too less in north and much more lesser in eastern India. There is a big gap between government and private sectors, which is much more in northern and eastern India. Funding of healthcare projects, especially cardiac care, is very poor, more so in Tier 2 and 3 cities. For example, as per the data available in 2011, the total available intensive cardiac care beds for whole of UP was around 1100, which is, though it is improving tremendously in the last few years. Lack of trained and qualified cardiac care professionals is another biggest challenge. There is acute shortage of healthcare professionals in the country and much more in northern and eastern India. These specialists include the super specialists and other paramedical staff like technicians, staff nurses, etc. In cardiac care also, there are acute shortage of specialists, which is much more in Tier 2 and 3 cities and is much better in southern and western India. In most of northern and eastern India, these facilities are seen only in capitals. Government participation in cardiac care is limited to only 1 or 2 institutions of that state. There is gross mismatch between the requirement and availability of properly trained professionals, especially the medical and paramedical staff. That too, super specialists is very glaring. There is compounding of problems like lack of facilities, lack of trained and qualified healthcare professionals, which lead on to delayed presentation of patients to the hospital. Even the distance of accessibility to cardiac care services, especially in emergencies and routine cardiac care, is especially the cardiology and cardiothoracic surgery, the distance traveled by a person, especially heart disease have financial constraints in getting their treatment done. Unavailability of financial schemes by the government to address these issues are glaring. There is lack of awareness regarding insurance, both to the individual or through government, though some states like Karnataka, Telangana, Andhra, Maharashtra cardiac care facilities were found only in very few numbers, and that too in major metropolis. Since then, cardiac care is improving in leaps and bounds. Also making available cardiac care facilities, especially Karnataka, Andhra, Telangana, Maharashtra, reaching out to district headquarters. With improvement in living conditions in Tier 2 cities, more and more specialists are moving to these cities for quieter, comfortable, relaxed, and environmentally friendly places. Funding of healthcare projects are happening both by the government, by PPP mode also, and by corporates. In southern states, insurance and special schemes are driving cardiac care in non-affordable class of patients. For example, in Karnataka, Vajpayee Arogya scheme for BPL patient covers whole cost of the treatment. So also the Yashaswini scheme, which is an insurance scheme for farmers, and all the school-going children in Karnataka are treated free of cost. So also government in other states is also stepping up to open many centers in Tier 2 and 3 cities. Government is also engaging private and corporate hospitals to treat these financially constrained patients. But it is happening only in very few states of the country. We all know that majority of cardiac diseases are preventable, provided people are aware and their ability to comprehend the benefits of prevention and treatment is understood well. Easy access to healthcare facilities and specialists are made available. And most importantly, cardiac care is available at affordable cost. We believe it does not live in the metros anymore. This is what I found moving from a Tier 1 city to Tier 3 city in UP. On this occasion of World Heart Day, true to the slogan of Power Your Lives, I appeal everyone to Karo Dil Se Dosti, including our colleagues who neglect their own lives, who are dedicated in treating patients, ignoring own health. Wishing you all happy World Heart Day, powering your lives. Jai Shri Krishna. Thank you. Thank you. I'm done with my presentation.
First question from Yatin. Hello, doctor. Will you please tell the way?
Yeah.
He's asking, will you please tell the way to help a heart attack patient just after the heart attack?
Yeah. So the most important thing is he has to relax. See to that if reach to a facility as early as possible, nearest place, and if the facility is at a distance, if possible, swallow a tablet of aspirin and try to reach the place as early as possible. And during this time, probably once they reach the hospital, I think probably we'll be safe and probably we can take care of the patient. Hello.
Next question from Prerna. Yeah, next question from Prerna. What are the key initiatives taken by the government to improve the efficiency of doctors and government doctors and government hospitals in India?
Efficiency of late, there are a lot of improvements which are happening, especially in terms of the equipment which are made available. The latest of the diagnostic facilities, the treating facilities are being provided by the government. There's also a lot of funding which is happening from the World WHO, especially in equipping the hospitals also. There's a lot of, apart from the infrastructure, more and more specialists, super specialists are being trained. The seats, especially the MCH or the DM or the DNB seats are also being increased. The more of paramedical and technical posts also, people are also being trained. And apart from this, doctors, especially with the better pay scales, better equipment, better infrastructure facilities, better working conditions, I think probably government is encouraging. But the effort which the government is making, I think still a lot more has to be done in terms of this. And of course, there are some institutions, probably the place where I was working earlier, there used to be some incentives which were being given to the doctors who were working, though it was a government institute. So that incentives, I think, probably used to probably motivate the doctors also to work much more in a better environment of world-class facilities which were provided to us at that time.
Priya, what is the current penetration of cardiac care services in T2 and T3 cities given the lack of infrastructure?
I think it is probably, we know that the cardiovascular burden is almost around 20 to 30% of all the cases which are being handled. And especially in the northern and in the eastern part of the country also, it is much more than the average Indian scenario. And the lack of, especially in one of the slides which I told you, there's a lot of less number of infrastructure which are available wherein probably a person can reach. The minimum distance a person has to reach, especially in the northern and the eastern part, is not less than 100 to 150 kilometers. Whereas in southern states, like places like Kerala, Karnataka, Telangana, and this thing, probably the distance traveled by a patient to these centers probably is much lesser. So government is also working, but it is. So in this scenario, I think probably the corporates, the private hospitals are probably the government and as well as the corporates on a PPP mode or something. So probably they can step in and to create more and more facilities, more and more professionals, especially to work in Tier 2 and 3 cities. With the digital India Connect, which the Prime Minister has announced, I think probably this is a wonderful way of at least connecting to the patients, especially through teleconferencing or probably the Skype or whatever technology is available, at least in the places where digitally we can connect, because whatever plans of infrastructure building in terms of roads, infra, this thing, those are things which are going to take long period of time, but at least in digitally, I think probably we can connect. And the people at that place, I think probably we can be talking to the primary care physicians, primary care doctors who see these patients first. I think probably they can have access to the super specialists, and accordingly, I think probably we can reach out to more and more people in Tier 2, especially in the rural areas as much as possible.
Next question from Ravi. What are the challenges faced in cardiothoracic and vascular surgery?
The challenges are too many, especially cardiothoracic and vascular surgical setup requires quite a lot of infrastructure, very trained, efficient manpower, the anesthesiologists, the technicians, the heart-lung perfusionists who run the heart-lung machines, the intensive care specialists, and the technical staff to take care of the patients in the ICU. And there are too many. And the equipment also which are involved in establishing a cardiac center are also better. So it is quite a capital intense probably investment to start a cardiac surgical unit, and especially in a tier 2 cities probably. So people only people where the facilities, at least the living conditions in that city, are quite good. Probably people will be motivated to come down to this thing. Now, slowly, with the government also opening up and the private and the corporate, they are planning to move to tier 2 and tier 3 cities, like what at NITI we have established a world-class center treating the cardiothoracic and surgical thoracic patients. So investment, probably especially the private players will withhold the funding or venture capitalists also will not be able to do it. Even if the government provides an infrastructure, people will not try to move out. Now, with the launch of smart cities, I think probably more and more tier 2 and tier 3 cities, I think probably they will be benefited, and more centers are happening. And especially in this sector, the government also is trying to help the below poverty line of patients. Especially we have seen in southern states like Karnataka, Telangana, like especially the Vajpayee Arogya scheme, which is for all the BPL patients, and the scheme for Yashaswini scheme for farmers. I know of especially a decade back in Andhra, cardiac surgical surgeries used to happen only in metros, and that too at very few centers. So once the government started a scheme for the BPL patients, the more and more hospitals started taking up these patients, and with that, the hospitals, the major corporates also started opening up their branches in district places. So that's how I think probably the government as well as the corporates, probably either individually or in a PPP mode, I think probably they can they should establish to take care of the cardiac care facilities, reaching out to tier 2 and tier 3 cities and beyond. Did I answer to the question?
Yeah, next question from Preeti.
Yeah.
What are the latest advancements in the cardiac care?
Cardiac care, I think probably it's happening. Probably cardiac surgery is a very young field, you can say. It's only probably last 60, 70 years, the first open heart surgery happened. And since then, I think with leaps and bounds, I think we are improving. In terms of the coronary care, especially the primary and especially for a heart attack patient, the moment the patient reaches the hospital, within 30 minutes, I think the diagnosis of the coronary artery disease is made, the blockages are diagnosed, and within probably less than 90 minutes, these patients are addressed and probably they are taken care of. So with more and more facilities reaching out to people, especially in tier 2 and tier 3 cities, this is a great boon. In terms of pediatric cardiac surgeries, there are only very few centers in the country which cater to pediatric cardiac surgery facilities, especially in north and eastern India. So except for the Delhi NCR area and probably other state capitals, I think these facilities are non-existent at all. So with many corporates and private organizations, I think they are reaching out to Tier 2 and Tier 3 cities, bringing the infrastructure specialists and the specialists, both super specialists and the technicians. The gap is being reduced, and I think more and more centers are coming up, and a lot of they are able to manage the cardiac care even in pediatric cases.
Question from Priya. Are
Yeah.
Tier 2 and Tier 3 markets equipped for complex cardiac surgeries and medical interventions?
Yeah. Yes. We were working in a Tier 1 city in a very big organization. So it is possible to establish a comprehensive cardiac care facility in Tier 2 and Tier 3 city, provided you have a good team. And for that, I think probably you got to have a world-class infrastructure to cater to that, where apart from the best of the equipments should be there, like what we are having in our place. We have moved down to this place with my whole team of cardiologists, cardiac surgeons, cardiac anesthesiologists, technicians, nurses, nursing specialists, and also the intensivists in it. So with a complete team, I think, and the infrastructure, I don't think there should be bigger challenge. The bigger challenge, especially in this area, apart from this, is especially the lack of knowledge of the people in and around this area, and probably the reluctance of the patient to seek medical advice at the cardiac care is also there. People have to be educated. This we found in the initial few stages, and now probably they are being made aware of the facilities. And of course, apart from this, I think probably constant education regarding the prevention of the cardiac diseases, prevention of routine preventive health checkups, I think probably are also happening. So this way, I think probably they are motivated, they are made aware of their diseases, and they are trying to seek the facilities which are coming at their doorstep, what we have been providing here.
Next question from Alexander.
Yeah.
What is your opinion about using teleconsulting as a mode to treat patients and also for doctors to connect with each other during emergencies in Tier 2 and Tier 3 setup?
Yeah, this is one of the best digital mode of connecting with the patients, especially when the patients are at remote places. So we also had this in southern India, I think probably a couple of places in Bangalore, in the place where I was working, and also in other place. Through the teleconferencing, I think probably we can reach out to any place. With this, I think probably off late, I think probably any part of the world, I think probably if a patient has an MI, reaches the place, gets an ECG, and through the teleconference or listening, the reports are immediately flashed, and within 5 minutes the reports are read, and probably what next line of treatment can be done. So also the teleconferencing mode, I think probably the doctors at the place where the patient is, I think with that. So if the doctors is able to give the reports, and I think probably we can chat with the patient, we can chat with the doctor, and probably the primary care physicians can be advised by the super specialists, and probably they need not have to come down, especially the distance is always a big problem, especially for when they are seeking for cardiac surgical interventions. I think probably those things can be clarified over the teleconference or the telemedicine route. So the facilities for telemedicine, I think probably more and more things are happening. I think especially flashing off of their images, especially the X-ray, the CTs, even the probably CT angios, I think probably if they are done in a place where probably cardiac surgical facility is not there, only the angios, I think probably they can show us the images, I think probably through the telemedicine approach. I think probably we can advise the patient and what best has to be done, and probably we can advise in case if they are seeking the surgical treatment to the nearest place. I think probably we can advise what time they should come down. And so after the surgery, I think probably post-op follow-up, they need not have to come down to the main place. So through the telemedicine, I think we and the primary physician at contact, I think probably, and there we can advise them and to take care of their post-op condition, or only if it is necessary to the center where it is decided. So, okay.
Next question from she's asking, where does India stand in coronary artery disease as compared to the Western countries?
In terms of the disease, I think probably it is projected that by 2030, the maximum number of cardiovascular disease patients will be around, I think probably 1.73 million cardiovascular deaths are happening all over the world. And by 2030, probably if the diseases are more, I think probably. So that's a huge number, and it's not a good distinction to have that. But in terms of the coronary artery disease treatment, I think probably we are doing extremely well, especially after the United States. I think probably the number of coronary artery bypass surgeries which are happening is tremendous. And apart from this, I think probably another thing would like to say is in India, I think most of the cardiac surgeons are doing these surgeries on a beating heart procedure. So this through the percentage of beating heart procedure, especially in coronary artery disease, Indians probably are ranked much more, especially in 90 to 95%. I think probably more and more people are doing this on a beating heart technique. Whereas in Europe and America, I think probably the percentage is around 50 to 60% or so. So we are catching up, I think probably probably when the numbers also are increasing, I think probably we may be in terms of treating, I think probably we may be reaching the number one position in terms of the numbers ahead of US also over a period of time.
Next question from Dr. Janki.
Yeah.
How is it possible to raise awareness among the general public to modify lifestyle to prevent complications due to CAD?
Yeah, I think probably apart from the government, I think individuals are the ones, I think probably they got to take care of their health. I think it's on this day, World Heart Day, I think there's a very good slogan, fuel your body to power your lives. So, of course, we know the risk factors for coronary artery disease. There are modifiable and non-modifiable risk factors. Of course, non-modifiable risk factors, you can't do much about that. At least modifiable risk factors like physical activity, obesity, eating habits, smoking, cessation of smoking. I think they go a long way in improving the lifestyle, and probably the lifestyle, I think probably had to be changed to de-stress yourself, so that I think probably you can prevent 80% of the coronary artery disease. I think probably we can prevent, probably we follow these regimes very well, and probably every year of the age of around 40 or so, you have a preventive health checkup, and if there are any factors which are there which are abnormal, try to correct them. So this prevention is always better than cure. I think probably we can avoid coronary artery disease to a larger extent, not 100%, at least to a larger extent. And this is the message, I think, the World Heart Federation is trying to drive in. And apart from this, I think probably the government's goal also, the global policy also, including the UN and also the WHO, is to decrease the burden of the cardiovascular disease, because it is going to be the major disease which is going to cause a lot of mortality over a period of time. The aim is to, it is 25-25 they say, so by 2025 reduce the incidence of cardiovascular disease by 25%. And in this, I think the individuals, the government, the policy makers, the corporates, everyone have to chip in to reduce the cardiovascular disease burden.
Next question.
Yeah.
How much does the cost of cardiothoracic surgery in India?
The cost of the surgery, of course, it varies. It varies. Probably in a government organization, I think probably it is around for a CABG, it costs around 1.5 to 2,000, 1.5 to 2 lakhs. Probably in a private sector, it may be a little much more. Average Indian family, at least 60 to 70% of them, I think probably, there's a great burden on them to undergo cardiac surgical procedure with that huge cost. So apart from this, I think probably, though most of them are poor, the second thing is, I think probably there's not much of penetration of the insurance agencies to tackle these patients. The third thing is probably the government also, only except for few southern states, other states, including the central government, is not coming to the rescue of these patients. Third thing is the NGOs and other philanthropists, I think probably they also should chip in probably to mitigate some of the sufferings. The cost of cardiac care, I think probably is not going to go down. I think probably it's only the government which can try to help the mitigate population, and probably they can reduce the cost of the consumables which are used in the surgery and the cardiology procedures, probably making it cheap or probably abolishing the tax also. So thereby, I think probably making these treatments more affordable.
Next question from Alexander again.
Yeah.
How much do familial metabolic disorders contribute to pronouncing CAD in successive generations?
Familial, I think probably it's a very minuscule of the number, I think probably, which contribute to the cause of coronary artery disease. It's only in the, especially hypercholesterolemia, which happens especially in the younger age group. I think probably we have seen a couple of patients as young as probably around less than around 10 years of age who had triple vessel disease and who had to undergo a bypass surgery. So they are all probably in a lifetime of at least of 30 years of experience. I had to see only 1 or 2 patients. But I think probably these patients, I think in a lesser vein, I think probably over a period of time, if the numbers, especially the cholesterol, LDL, other parameters, I think probably they are not taken care of, especially since the younger days. I think they are at a greater risk of developing coronary artery disease, much more than the normal other individuals.
As we take our last question, by Alexander, what kind of content would you as a cardiologist mostly like to view on a mobile knowledge sharing platform?
on a mobile. Okay. One thing is, I think probably heart is one of the most strongest organ in our body. It beats around 72 per minute. I think probably in a lifetime of a person of around 80, it beats around more than 330 crores, 330 million times. And do not abuse it. Take care of your heart. Karo dil se dosti. Have a healthy lifestyle. Have physical activity. Have a nutritious diet. Avoid smoking. Probably this will power your life.